A lot of parents have asked me to talk about bedwetting because a lot of their children are having the problem of not waking up at night and hence peeing in the bed. From what I know and what I have read and the existing research, I can say that usually children get potty trained between the ages 3 to 5, which means by the time the child is 5, normally they do not pee in the bed. But there are many children who continue bedwetting up to the age of 7, and it is okay for a child to occasionally wet the bed till the age of 7, because different children develop differently, and sometimes certain children develop this ability to hold their bladder much later. So developmental delay in this area is common up to the age of 7. So if your child is less than 7 and is bedwetting, I would suggest that be a little patient and do not worry too much. But beyond 7, if your child is still bedwetting into teenage years, then there is something you need to be concerned about and you need to work on it. Bedwetting can also happen not just because of a developmental issue, but also sometimes if the child is very hyperactive. So autistic and ADHD children have a tendency to have bedwetting problems, but also children who do a lot of physical activity during the day and hence they have very deep sleep at night. And children who sleep very deeply at night also tend to bedwet because they are too tired and too deeply asleep to wake up when the bladder is full. When children play a lot during the day, forget to drink water, and then at night just before going to bed they drink lots of water, that is also when the chances of bedwetting goes up. So it is important to educate your child and to make sure that the child drinks enough water during the day. So just before the child goes to bed, about an hour or two before bedtime, the child's liquid intake has to reduce. This is another practical way to prevent bedwetting. Also, what we have found out is there are emotional reasons behind this. So if a child is going through a lot of stress, or if the family environment is very stressful, dysfunctional and violent, so there is a lot of domestic violence at home, or if the child has been physically abused or sexually abused regularly, then such children also have a tendency to have the problem of bedwetting. Oftentimes children who are extremely fearful tend to wet their beds at night. So it is important to have a conversation with your child and also understand if there are areas that are causing extreme stress or fear to the child, then that also results in bedwetting, and then those areas need to be worked upon. Now, as per the research, there are two most commonly used methods for bedwetting. One is the alarm method, where there is some sensor put in the child's underwear, and as soon as it senses moisture, an alarm goes off, in which case the parent or the child wakes up and then the child goes to urinate at night. So the alarm method is one way, and hypnotherapy is definitely another way which is very commonly used for bedwetting. As per research, hypnotherapy is not yet significantly better than the alarm method, but from whatever I have read and understood, because I am a clinical hypnotherapist myself, it has worked in some of the cases where I have applied it. In hypnotherapy, what we do is we of course give certain recorded suggestions to the child. So when the child is in a slight state of trance, which is a very relaxed state, there are certain suggestions given to the child about waking up as soon as the bladder is full, or visualizing that there is an alarm clock in the bladder, and as soon as the bladder is full, the alarm goes off and the child wakes up. And when these suggestions recorded are given to the child to listen every night, over a period of time the child's subconscious mind or the body absorbs or takes in the suggestion, and the child stops wetting the bed. Remember, if your child is wetting the bed, then do not make the child self-conscious about it, because it will definitely impact the child's sense of self-worth and confidence. Make sure that the child understands that this is a problem that can be overcome with some practical tips as well as some of the techniques I have said. So positively educate your child. Be a little patient, because when you really patiently deal with the child, this problem can be overcome. But if children are made to make very conscious about it, if you are anxious about bedwetting, the child becomes anxious, then remember, anxiety and fear will just aggravate the bedwetting problem. It will not solve it. So you have to be patient. Teach your child also that even when the child is asleep, the mind and the subconscious mind and the body are working, which means that even if the child is asleep, the body can recognize if the bladder is full, and the body can wake up and go to the washroom. So if the child, indirectly, if you talk to the child about this, if you teach certain practical things, manage the sleep schedule properly, and try some of these hypnotherapic suggestions to the child, then trust me, this problem can be easily solved. It is not such a big deal. Be patient and encourage your child to look at it positively. Make sure that your child does not feel that he or she is a problem. Do not make your child very self-conscious about it. Yes, as parents, you will find a lot of hypnosis scripts online, which you can use, record in your voice and play it for the child and see if hypnotherapy can help. Otherwise, there is also the option of medications, but that should technically be the last resort. So I hope this helps you. All of you whose children have bedwetting problems, I would strongly suggest that work on two areas. Address the child's fears or stress if there are any, and secondly, use hypnosis or auto suggestions at night every single day. Try it out for a few months and see if that helps. In my clinical practice, I have worked with a couple of kids using hypnotherapy and it has helped. And we have also addressed their fears. So if you are abusing the child, or if your family environment is causing stress to the child, then you know where you need to work on. I hope this was helpful.